It's an age-old problem. As you age, your back gets older too. And even if it never was sore before, your spine may start to show signs of pain and problems. Dr. Michael Steinmetz is here to help us bone up on how to bolster our back. Dr. Steinmetz is the chairman of the Department of Neurosurgery at Metro Health. Thanks for joining us today.
Thank you. Thanks for having me.
So what kinds of issues will arise as we age when it comes to our spine?
So we face a lot of issues as the spine ages. The spine tends to deteriorate over time, and it's occurring in all of us. And the key thing when we talk about this is that this is a fairly normal process. And why that's important is that not everybody develops symptoms from what we're about to talk about. But I like to categorize how the spine changes in three large ways as we tend to age. And first is the posture, or the orientation of the spine. We have normal curvatures of our spine when we're born and we develop, and those curvatures tend to straighten out over time. And why that maybe seems...
Then we'd walk straighter.
Yeah,
right?
well, it seems good because we'll stand straighter. We really don't. What it tends to do is tends to push us more forward. It tends to push our spine out of balance, and that can cause pain.
Is that why you see older people sometimes...
Yeah, that's right. Sometimes
over?
they bend over and stoop over. It's often due to that straightening process of, of degeneration.
What's the second issue?
So the second issue is arthritis. And what does that mean? Arthritis is not a clear term. It's somewhat of a vague term, but it is really that term we use for the degeneration of the spine. And what happens there is the discs in the spine collapse. They bulge. Everybody knows somebody with bulging discs. We develop bone spurs. And this can develop into pain. You can get pain like you get in your knee or shoulder when you get bone-on-bone disease. But it also can pinch the nerves and cause arm pain or leg pain. And that's probably the biggest thing we see when people develop symptoms due to degeneration in the spine.
The third issue.
And the third issue is largely osteoporosis when we're talking about the aging spine. This is a very significant issue at times. It's a very prevalent issue in our population, and that's really a thinning of the bone, sort of say. And why that becomes important is that thinning of the bone can cause fragility, and that fragility can cause fractures. And much more important in the postmenopausal women.
My wife's concerned one day she's going to wake up and just be a pile of dust.
Yeah.
We can't stop ourselves from getting older, and we don't want to, but is there anything we can do to keep our spine strong?
Yeah, there's many things that we can do to maintain what I call good spine health. And the good thing is they're all going to be familiar because these are things we should all be doing to live a nice, healthy lifestyle. One of them is posture. I saw you sitting up a little straighter. Our mothers were probably correct. We should be sitting straight up in a chair, and we should walk straight up. That's good for our overall spine. We shouldn't slump in a chair or lay on the couch and that sort of thing. Keeping weight off is very important, especially for the low back. Carrying weight can cause significant pain in that area. Eating a well-balanced diet is critical. There's no special diets for spine. I tell people just a well-balanced, healthy diet is critical for that. Regular exercise is important. That not only is it aerobic exercise, just getting out and walk, for example, but also maintaining good core strength, especially of the low back. And it doesn't have to be anything intense or specific. It can be just 10 minutes in the morning, 10 minutes at night, focusing in on the core.
If we're already having problems, then what?
If you're already having problems, there are some simple things that you can do without even seeing a specialist. You can focus on stretching the back at night or in the morning. Some over-the-counter anti-inflammatories are helpful. If it gets worse, massage therapy, chiropractics can be good for that sort of acute pain you have. And if nothing's helping, probably trying to seek a spine specialist would be important.
And spine specialist would do what? Surgery? Is that the...
No, not at all. In fact, most of what we do, I'm a surgeon, I guess I shouldn't say that, but most of what we do as a spine group is non-surgical. So
really?
The key thing is getting someone to be evaluated by a spine specialist, determining what the problem is, and then getting him in the appropriate therapy. It may be medicines, it may be therapy, at times it may be surgery. But
Great.
Surgery is usually the last straw.
Great advice. Thank you, Doctor.
Thank you.
Aging may be inevitable, but there are things you can do to help you keep your back at its best. Follow Dr. Steinmetz's advice, and for more help, use the information that's coming up next.
Learn more by calling Metro Health at 216-778-7800 or visit www.metrohealth.org. Want more Metro Health medical information? Be sure to tune in to WTAM 1100 Radio each Saturday morning at 7 for Metro Health and You, hosted by Dr. Christine Alexander. Next, here's a deadline you can't miss.